Hi, this is Joyce from Inspire Online OET Training. In previous video, we have learned regarding the tips and strategies for reading part A. Now it's time to apply these tips and strategies in our practice. Let's start it.
This passage or the booklet gives you regarding the fracture dislocation sprain as main heading, so that I have highlighted this area. At the same time, when I come under this text A, text B and text C, text D, I found out some of the points as important for me for finding out to the answer very quickly. That's what I highlighted these areas. Fractures, dislocation, sprain here. Okay, they are giving definition of in text A, and in text B it is talking about the simple fracture of limbs, its immediate management, clinical assessment and management. Okay, some of the points I have highlighted here to locate to the answer. Okay, hemorrhage, pressure bandage, direct pressure, immobilize affected area. Yeah, I found these all points as very important. And when we comes to the management area, splint the site of the fracture or the dislocation using a plaster back slab to reduce pain, elevate limb, a sling for arm injuries, a pillow for leg injuries. Administer analgesia. If not allergic, give morphine. If allergic to morphine, use fentanyl. Then compartment syndrome. Okay. Like this way, you have to skim throughout the text. Okay, you don't have enough time to read full content. Okay, that's why I'm telling you, you have to use your skimming technique to find out these type of important points to locate or to highlight. Then when comes to text C, it is talking about the drug therapy protocol, and the drug name is morphine. Route of administration, IM or subcutaneous, then IV. Okay. Then provide consumer medicine information. Advice can cause nausea and vomiting, drowsiness. Respiratory depression is rare. If it should occur, give naloxone. Then when we comes to text D, it is talking about the technique for plaster back slab for arm fractures. Use same principle for leg fractures. Then some of the numbers are written over here. That's why I highlighted these areas with yellow color. So these are the highlighted points which I found as very important for finding out the answer very quickly. That's why the skimming technique is very useful for reading part A.
Now we can see different types of questions that included in part A OET. The first 7 questions are in the way we have to answer A, B, C or D, in which the text included the given information. So here it is clearly written for each question 1 to 7. Decide what text A, B, C or D the information comes from. You may use any letter more than once. Okay. Next, we can see the second part of questions that they are given to you from 8 to 14, 8 to 14 questions. That means again 7 questions. 7 questions they are provided to you for answering in a word or in a short phrase. It is clearly written here. Answer each questions 8 to 14 with a word or short phrase from one of the text. Each answer may include words, numbers, or both. From the text itself, you can pick up or answer in the way just like in the text they are given to you. The third part of question included is fill in the following. You have to answer those questions in the way that is given to you not in exact way of question or in the passage given to you. Sometimes you have to change some words into the way that exactly matches in this fill in the following. Now we can see in detail each questions along with these passages how to find out. Here I have highlighted some of the points that you have already noted. These all are the points which I found as keyword. Now we can see how we can locate the answer quickly. The first 7 questions are quite easier than the other questions. So that I'm suggesting you to do from 8 onwards, because as we go from 8 onwards, we get an idea throughout the passages, okay, in which text those given information are including. That's why I'm telling you, you have to answer from 8 onwards, because these are the questions which consumes lot of time. So start from doing 8 onwards.
As I mentioned you earlier, we can start with the question number 8. The question is, what should be used to elevate a patient's fractured leg? Some of the keywords I have highlighted here in this question: what, used to elevate, and fractured leg. In my mind, I have already gone through these passages and I got an idea. Maybe the answer is located in the second text. That means text B. While I am going through this text B, I am going to locate some of the keywords like elevate and fractured leg. Yes, immobilize clinical assessment, then splint the site of the fracture or dislocation using plaster. No, this here is elevate. Elevate. Then, what is the next keyword? Fractured leg. So, they are only asking regarding the fractured leg. So, here we can locate the leg injury. Yes, here. A pillow for leg injuries. Elevate the limb, a pillow for leg injuries. So answer is a pillow. A pillow. This is the way we are going to locate to the answer. Next question is, what is the maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular route? What all keywords you can pick out from this question? What? Yes, what? What means exactly somewhat noun form of answer. And maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular route. So, IM route here. In this box, it is telling about the IM and subcutaneous, and the maximum dose we have to find out for the morphine administration. Maximum dose is 0.1 to 0.2 mg per kg to a maximum of 10 mg. So answer, they are asking regarding per kilo of a patient's weight. Per kilo of patient's weight. So the maximum dose can be 0.2 mg per kg. This is the answer. This is the way you are going to locate to the answer quickly. Okay. From the question, you have to pick out some keywords, and from those keywords, you have to find out whether it is in a noun form, whether it is in an adverb form or adjective form. These all forms you have to understand. Then only you will be able to answer those questions. And next question is, what should be used to treat a patient who suffers respiratory depression? So, respiratory depression, exactly in text C. For the respiratory depression patients, it should be occur
We have to give naloxone. Yes, answer is naloxone. This is the way how you want to utilize your skills for finding out answers in reading part A. You just want to take only 35 seconds for answering each questions. This is the way how you can locate to the answer quickly. Next question part is fill in the following. Remember that the first 7 questions are left there. We didn't answer those questions because when we go through the other parts of question, that questions will consume extra time for getting answers. That's why we are consuming those time for answering the second and third part of questions. The third type of question here are fill in the following. Let me take the first question of that fill in the following part. Falling on an outstretched hand is a typical cause of a dash of the elbow. Some of the keywords we can take from this question is falling, outstretched hand, typical cause of a dash of the elbow. So we can take those keywords to locate to the answer. That is the scanning method. Here we can see outstretched hand, falling elbow. Okay, where you can locate to the elbow. Which text is mentioning about the elbow? Here. The answer is located in text A, dislocation. Elbow dislocation after falling on an outstretched hand. So answer is falling on an outstretched hand is a typical cause of a dislocation. Dislocation is the answer of 15. The next question is upper limb fracture should be elevated by means of a. Some keywords I have highlighted here. Upper limb fracture and elevated means of a. So it comes in text B. Answer is somewhat in this area. Okay. Answer is sling. Likewise, you have to do the remaining questions. In each questions, you have to pick out the keywords for locating to answer quickly. This is the way how you can answer or how you can locate to the text that is given to you. After doing this fill in the following area, we are going back to the 1 to 7 questions. The first question is procedures for delivering pain relief. We have to answer it in letter A, B, C, or D in the text in which those information are included. So the first question is procedure for delivering pain relief. The keywords I have taken from this question is procedures and pain relief. Okay, procedures for delivering pain relief. It comes in text C. So that's why I'm answering it as C. The next question is the procedure to follow when splinting a fractured limb. Here I can take the keywords like procedure, splinting, fractured limb. Definitely it comes in text B. So answer is B. Likewise, you have to do the remaining questions. I hope you all get an idea regarding answering these questions. You just have to take 35 seconds for answering each questions. If you won't get answer within this time limit, just leave it and move on. This is the way how you have to answer, and finally you will get enough time to answer those missed questions. Thank you.